background noise. You may want to consider changing your view to presenter view so you can see the person speaking along with the slides. And then we will have the presentation available both as slides and as a recording. And then with that, we are also recording this presentation. I think everybody probably just got a notification about that. So just click yes. And then closed caption is a new option that's available to all participants. You may need to select that option to be enabled if you want it to be available. I think that's an option down at the bottom of the screen. You can find that there. Just a little bit of information about our speakers. So Maureen Neumann is a Senior Program Manager for Health at the National Recreation and Park Association. In her role, Maureen primarily oversees NRPA's food access portfolio, ensuring that park and recreation professionals have access to programs and resources to support healthy food access strategies across the nation. A key element in the role Parks and Recreation play as community wellness hubs. Maureen has been a part of the NRPA team for over 5 years. Maureen is passionate about the mind-body connection and believes movement is a core tenet of health and well-being. She is a registered yoga instructor and prioritizes time for movement each day. She enjoys frequenting her local park system, exploring trails, and soaking up the power of nature. Excuse me. Tiff Cunin is a Senior Manager for Health at the National Recreation and Park Association, where they manage multiple bodies of work, including healthy aging and youth mentoring in parks and recreation. Tiff is committed to social justice and health equity, a core tenet of NRPA's work. Tiff is a physical activity in public health specialist, credentialed by the American College of Sports Medicine, and is passionate about innovative interdisciplinary approaches to advancing population health through physical activity, recreation, and play throughout the life cycle. Additionally, Tiff is a PhD candidate at George Washington University School of Medicine and Health Sciences, where they are exploring the intersections of transgender identity and race in the realm of social participation. Tiff is an outdoor enthusiast who loves to surf, snowboard, hike, camp, and more. They play softball with Chesapeake and Potomac Softball CAPS League based in Washington, D.C. area. Tiff is also a member of the CAPS Diversity, Equity, and Inclusion Committee, where they help identify strategies that promote a culture of inclusion, acceptance, and diversity for all its members, regardless of social identity, and especially people of color, women, transgender, and non-binary people, people with disabilities, and others who have been historically denied the ability to participate in recreational sports and physical activity programs. We're excited to have Maureen and Tiff here to present how parks serve as community wellness hubs.
Great, thanks, Jen, for welcoming us. I will go ahead and share my screen here, and I will make sure that sound is on. Yep, perfect. All right, well, thanks again, everyone, for having us join you today. We're so glad to be here. I am Maureen Neumann. I use she, her pronouns. And as Jen said, I'm a Senior Program Manager on our Health and Wellness team here at NRPA. And I am joined by my colleague, Tiff.
Yeah, thanks so much, Jen, and thanks so much, Maureen. I'm really excited to be here. Tiff Cunin, my pronouns are they and them. I'm a Senior Program Manager on the same team with Maureen at National Recreation and Park Association. Super enthusiastic about finding ways to connect folks to equitable access for physical activity, recreation, and play. So I'm super excited to be here, and thank you all so much for the opportunity. I'm going to hand it back over to Maureen to start us off on our presentation.
Cool. Thank you. So yes, we are with NRPA, the National Recreation and Park Association. We are the leading not-for-profit organization dedicated to advancing strong, resilient communities across the country. So we are a membership-based organization, and we represent local park and recreation agencies across the country. So the professionals and their agencies that they represent are our members. We work to support the field of parks and recreation through advocacy opportunities, networking, professional development, grant-making strategies, and just the general well-being that comes with membership. So we are so thrilled to be in this space. We work across 3 core pillars: health and well-being, climate readiness, and equity at the center. So what that means is that we center equitable strategies and systems change in all that we do, both internally as an organization and externally for our members. So we've got a variety of resources. We'll dive into those a little bit later in the presentation on how we support equity, but just know that is a core tenet of our work. We do have a robust website where you can find many free resources available for download. We have a monthly Park and Recreation magazine that highlights and lifts up the work that is happening across the field. And we have an award-winning podcast, Open Space Radio, that we do encourage you to take a listen to. So today in our time, we'll be talking about what is a community wellness hub. So a lot to get into, a lot to unpack with that phrase, but we have plenty of time to get into it, and we're excited to be sharing this work with you. We've got some examples of hub models in action to really bring this to life. And then, as I mentioned, some resources to support hub development and creating hub models in communities across the country. And lastly, plenty of time for questions. And I will just point out that the background on the screen here is NRPA's headquarter office in Ashburn, Virginia. That is Northern Virginia, about 40 minutes outside of DC. We have transitioned to a fully remote workforce, so we are spread across the country, but lucky enough to still have this building to call home occasionally. And we've got a lovely pond, and it's actually located in a park. So we are grateful for the opportunity to have that home to support us. All right, so before Tiff and I spend the next few minutes kind of talking at you, wanted to just really center what is a community wellness hub. And we have just a quick little video here to share and help illustrate this work.
Across the country, park and recreation professionals have emerged as public health leaders dedicated to improving health outcomes, advancing health equity, and enhancing quality of life for all by helping their agencies step into the critical role of community wellness hubs. Community wellness hubs exist to promote access to vital health services, especially for our most vulnerable and historically marginalized communities. They're trusted gathering places for activities like youth sports, fitness classes, out-of-school time programs, and more, where people can access nutrition, education, healthcare, and other essential services that directly influence health outcomes. What does a community wellness hub look like in action? They're food access points, like farmers markets and community gardens, places to find enrollment assistance for programs like SNAP and WIC. They offer chronic disease management and health literacy programming. They're a resource for mental and behavioral health services and a link to diverse healthcare and social service providers throughout the community. As park and recreation professionals continue stepping up to make system-wide changes that prioritize community health and well-being, we believe they can be a catalyst for advancing health equity and improving health outcomes for all people. The National Recreation and Park Association is committed to supporting our nation's park and recreation agencies serving as community wellness hubs. To find our best practice guides, case studies, and tools, visit nrpa.org.
All right, so excuse me. That was just a really quick look at what we are talking about when we talk about community wellness hubs. But I really like that video for just quickly summarizing, and you'll hear me say a lot of the same ideas that we heard in the video, but just a little bit of a deeper dive. So to reiterate what the video shared, we view parks and recreation as really essential to community health and well-being. We believe that access to these spaces, these programs and services really remain essential to community vitality and is one of the key factors in advancing health equity, improving individual and community level health outcomes, and just fully enhancing quality of life. We believe that park and recreation professionals, in partnership with their community members, are really uniquely suited to serve as stewards of community wellness hubs. And as you heard in the video, we define community wellness hubs as these trusted gathering places that connect every member of the community to essential programs, services, and spaces that advance health equity, improve health outcomes, and enhance quality of life across 7 dimensions of health. So Tiff is going to dive more into those 7 dimensions here in a bit. But just essentially, community wellness hubs are essential to health and well-being. They remove barriers and bridge gaps to help people across the sectors access vital health and social resources, and just really work to ensure that all people can thrive. So what we have found over our work exploring these community wellness hubs is that they're kind of organically happening. And they're really just building on the existing strengths, assets, and foundations of local park and recreation agencies, as these agencies and the professionals on the teams are working to address the root causes of health and social inequities and promoting health across multiple levels of intervention. So really serving as essential infrastructure and providing these essential services that center people and their individual lived experiences and unique needs. We're seeing these hub models really leverage partnerships. Tiff and Robin, I know you were talking a little bit about this before the call got started, but those partnerships that are so key, and the resources, skills, and knowledge of other sectors that come together to integrate programs and services that advance equity, resilience, and health and well-being, those same core pillars that NRPA feels that we represent. So all that to say, what does a hub look like? What is it? We really believe that it can be a couple things. So we see park and recreation professionals and their community partners working to transform specific physical spaces. So think of a community or a recreation center, park space, things like that, a true physical space. They can be transformed into community wellness hubs by providing equitable and inclusive sets of programs and services in that one central location. So a great example that Tiff shared before the call got started was medical center partnering with the local park and recreation department to be both in one place. That's just a really high level synopsis. We'll share more examples as we get deeper into this. So again, they can be a physical space, but we're also seeing that these hubs can be kind of a function. They can be stewards of systems level change. They can work to shift agency missions, operations, practices to function in that more holistic, intentional, interconnected way and deliver services out to the community. So think of referral services or idea sharing, again, that systems level policy change to serve as a hub model. So that holistic lens, looking at lots of different levels and elements, that's a really critical piece of our hub model. So we do recognize that there are different needs and different wants in each community, and we really support park and recreation professionals listening to their communities, acknowledging that the professionals are part of their communities as well. So thinking of their own needs, doing community needs assessments, looking at health improvement plans, and creating a hub that is reflective of the needs and wants of the community. That results in these hub models looking different in every neighborhood, city, and county, but connected by the overarching goals of advancing health equity, improving health outcomes, and enhancing quality of life for all people. So the image on the screen is pulled from our newest resource, the Community Wellness Hub Digital Toolkit. We'll get more into that, but what you're seeing is a highlight of the 4 phases that we envision working through when developing a hub, encircled by key considerations for each phase of planning. So it's intentionally designed in a circle because we see this work as cyclical. We don't see a true end point for this work. We anticipate that these hubs are created by revisiting stages and considerations throughout the efforts, and continually checking in to ensure that what is being put forward is what's wanted and needed by the community, and is something that can continue to be supported and sustained. So you'll see on the screen we have kind of the first phase, developing partnerships, collecting information. That's what I alluded to in assessing the needs and wants of the community, assessing what's already existing and how that can be brought into the hub model to support this work. Phase 2, engaging a core stakeholder group. So who is here to support this work? Who is available to provide input, provide feedback, kind of be your thought partner as you think of what a hub model could look like in your community. Phase 3, identify vision and objectives. That's really getting clear on what this hub can provide for your community. What are your priorities? Where are gaps that you could fill and step in to serve? And what do you hope to accomplish through this work? And phase 4 is defining key strategies and developing action plans. So we are big proponents of having plans in place. We know that staff turnover happens. We know that change of leadership happens. So being able to point back to an action plan and say, this is what we envision, this is how we'll get there, this is who's responsible, creates just those open lines of communication and transparency that can help lead to success. And then around the edge, we have centering, advancing equity, building and maintaining partnerships, advocating, providing continuous communications, evaluating, and identifying funding. And those are the elements that we see as key parts of each of these phases, and elements that we can come back to and say, okay, are we advocating for this work? How are we identifying funding? Are we communicating properly with the community so they know where we are in our phases, in our work? And always, are we centering and advancing equity? Is what we are putting forth as our hub model what the community wants and needs? Is it reflective of the community we're serving? And does everybody have access and the opportunity to thrive within this space? So that is just a very quick look at our hub models. And Tiff, I will pass it to you now.
Great, thank you so much. So I'm super excited to be able to work with Maureen to present this workout. I'm a theories, models, and frameworks nerd. I love interdisciplinary and cross-disciplinary work and team science. And that's really the embodiment of what a community wellness hub can be in your community. So as Maureen alluded to, there are 4 primary phases that need to be worked through in order to establish a community wellness hub. In addition to each of these phases, there are considerations that should be present throughout the development process. And before a community starts working on their hub model and the components, there are key questions to consider, such as, are there existing organizations, coalitions, or partners that are already supporting community health efforts? Because that's going to be important when it comes to identifying stakeholders. Are there clear unmet needs that have been identified by the community? And who's leading conversations about the needs and priorities of underrepresented and historically disenfranchised groups within the community? The development of the Community Wellness Hub is built in these phases, with each of these phases building onto the previous one. It's essential to engage community members, especially those who have been pushed to the margins of society, historically disenfranchised, and underrepresented throughout each phase. And when we talk about park and recreation professionals of all levels, as well as cross-sector, cross-disciplinary, and community-based partners, like many of you in this room, and key decision makers should also be involved in each phase. So what we want to remember here is that an upstream approach requires surrounding the problem or the root cause. So if you peel away all the layers of the onion, the root cause is at the core. But we want to make sure that with that upstream approach that we surround the problem with all the stakeholders who are impacted by it and have a role to play in creating a solution. So on the next couple of slides, I'm actually going to walk you through each of these phases briefly. So we can go on to the next slide, Maureen. All right. So here we're looking at phase 1. So developing partnerships and collecting information. What you're going to want to do here is to start by building, strengthening, and joining an existing partnership or a coalition to support the hub in the short and long term. Also during this phase, it's important to engage with community members, partners, and organizations to understand what the current needs are, what assets and resources exist, and gather the requisite information and data from diverse sources that are key in this phase. A community health needs assessment and community asset mapping are activities to conduct during this phase as well. This will help you collect information about the needs and opportunities that exist across the community from the diverses that we want to center in the hub. Next, you'll want to identify like-minded organizations with resources and assets that can continue to support the hub's vision and goals. Let's go to the next slide for phase 2. Right. So in phase 2, this is where we want to engage our core stakeholder groups. So once you've started convening partners around the hub's development and analyzing data from the needs assessment and asset mapping, now it's time to begin determining the key strategies and activities of your hub. It's critical to ensure that you're gathering information from all potential stakeholders and beneficiaries of the hub. To develop the overall vision, goals, and action plan, you'll want to create a core stakeholder group or advisory group to move this work forward. Let's go to the next slide. Phase 3, identifying vision and objectives. During phase 3, the core stakeholder group mentioned previously will help guide collective decisions as you identify your hub's vision, mission, overarching goals, and specific short, medium, and long-term objectives. Some key points here is that you're going to want to define the vision and mission of your hub. So you're defining the need here. What is the reason behind your hub and what will it address? Next, identify overarching hub goals, ideally 3 to 5 goals. And what do you expect the effects of the hub to be here? What will its impact be on the community? Then you want to break down overarching goals into short, medium, and long-term objectives. What will your work accomplish in the short, medium, and long term to achieve your overarching goals? So many of you here are very similar with roadmaps and logic models. This is really what we're alluding to here, is defining the goals and the objectives and the outcomes, activities, inputs that are all associated with developing and implementing your hub model. Let's go to phase 4. In phase 4, this is where you define key strategies and develop action plans. In other words, this is the action-oriented phase where you begin implementing the hub's plans around the key strategies and activities that you hope to achieve your short-term, medium, and long-term objectives with. You want to continue to work with your core stakeholder or advisory groups, as well as your broader group of partners to gather input on the best strategies or solutions for the development of an action and implementation plan for your hub. During this phase, you'll want to review the dimensions of well-being and the hub strategy sections of the Community Wellness Hub Toolkit. I dropped that link into the chat box a few minutes ago when Maureen was speaking. But you'll want to review those dimensions of well-being and those strategies to ensure equity is centered as you develop the action plan. It's really important to outline how your hub's overall goals and the short, medium, and long-term objectives align with your action plan. Now, let's talk about the 7 dimensions of well-being that go along with this hub model. So we're going to spend a little bit of time on this slide and take a moment here just to look through the different dimensions that are included in this model here. Think about, we're here in the context of physical activity planning. Think about each of these dimensions as you see them on the slide in front of you. Think about how each of these dimensions are addressed by physical activity programming, or how they can implicate or be a part of physical activity programming, either on the front end or as a result of effective physical activity programming for your communities. So we're going to talk a little bit about these dimensions of well-being and how they make up the Community Wellness Hub. Community Wellness Hubs should be designed to advance health and wellness across each of these 7 interdependent and interconnected dimensions of well-being. These dimensions are cultural, economic, emotional, environmental, intellectual, physical, and social. Park and recreation professionals can implement a variety of policy, environmental, and behavior change strategies that align with each of these dimensions to function as a community wellness hub. They can also bring their partners and cross-disciplinary stakeholders along with them in that work. Let's talk about each of these dimensions. We're going to stay on this slide, and we're going to start with cultural. So with the cultural dimension of well-being, communities provide culturally relevant spaces, programs, and services. Community members, including staff, develop a sense of belonging, inclusion, and appreciation, and they embrace, celebrate, and value the identities, traditions, and experiences of others. Economic. Communities provide access to economic opportunities and economic stability, including fair and good paying jobs, workforce development opportunities, and affordable housing, healthcare, food, and other social resources. So if you recall earlier, Maureen was alluding to how community wellness hubs can lend themselves to being a space where community members can access a wide range of services, whether that's healthcare, social services, other types of wraparound services. And so community members are economically and financially secure and contribute skills, talents, and passions to the community and have a pathway to economic opportunity. The emotional dimension of well-being is where communities understand, embrace, and promote emotional and behavioral health and provide spaces, programs, and services that support emotional health. Community wellness hubs are a place where community members can develop and explore feelings, values, and attitudes, practice mindfulness and self-awareness, and manage emotions and behaviors. So for example, for a youth mentoring model, it is a great place to have youth centered where they can engage in activities that enhance their social emotional learning and can enhance their ability to navigate day-to-day situations when they may not have had that experience elsewhere. The environmental dimension of well-being. Within the Community Wellness Hub and the environmental dimension, communities promote environmental justice and provide clean air, water, and green space to ensure that all people, especially Black, Indigenous, people of color, and low-income communities, have access to and can connect with the outdoors in meaningful ways. They are resilient in the wake of climate change and are mitigating against future environmental threats. This dimension keeps community members aware of how the natural and built environment impacts health, and the time they spend connecting with the outdoors, and then they take action to promote environmental justice. Intellectual. Within the model, communities provide access to equitable and high-quality learning opportunities. Community members can enrich the mind through an openness to new ideas, experiences, questions, and thoughts, and through learning new skills and seeking to understand different perspectives and lived experiences. You're probably already starting to see this, but many of these dimensions are not just connected, but have overlapping characteristics. The physical dimension of well-being. Communities within this model provide environments, programs, and services that promote opportunities for all people to be physically active.
Let's make some salsa.
Safe. Somebody have a question? So we'll go back to the physical dimension of well-being. This is where communities can provide environments, programs, and services that promote opportunities for all people to be physically active, safe, and have access to nutritious and affordable food, and have access to quality healthcare. All community members can then easily and safely access opportunities that support the development of healthy eating, physical activity, rest, and self-care habits and behaviors. And finally, the social dimension of well-being. Communities within this model will then provide opportunities for socialization, connection, relationship building, a wide array of social participation activities. Community members can develop and maintain healthy relationships and meaningful connections, positively interact with others, and contribute to the community. As you can see, this isn't a circle model, so that means that there is continuous feedback happening throughout these dimensions, as well as with the phases that we alluded to earlier, the four strategies, the four phases of developing a model. So there will be continuous feedback between the phases, continuous feedback between the well-beings, and also continuous influence between the dimensions of well-being here, as well as influence on the strategies that we alluded to earlier that help develop and set up the Community Wellness Hub. All right, next slide, please. I brought us all the way to this slide just to say that to learn more about what a hub in action looks like, I'm actually going to turn it back over to Maureen now to show us just a little bit about the work that has been done already.
Yeah, thanks, Tiff, and thanks for walking through those 7 dimensions. Excuse me, it's helpful to have them as a foundation as we move forward. So I mentioned earlier that one of the arms of NRPA is grant making. And in 2019, we actually had the opportunity to, we received a grant through the Walmart Foundation. And in turn, we had the opportunity to pilot and evaluate these innovative nutrition hub strategies over a 2-year project period. So what ended up emerging was our kind of fleshed out hub model. And this grant specifically focused on food access, but through that work, we really organically began to see many of those other dimensions weave in. So those 7 dimensions that Tiff mentioned, they were kind of coming to the surface as work that was being done already. So keeping in mind that the basis for this work already existed in these 15 communities, they were doing meal programs, many were doing farmers markets, those types of activities. The outcomes of focusing this work as an intentional hub were still just so impressive to us. So over the 2-year project period, which I mentioned, it started in 2019. The work of this project actually started in March of 2020, which you may remember as the start of the COVID-19 pandemic. So these hubs were launching at the start of a massive health pandemic. Soon into the summer, the uprising of racial tensions following the murder of George Floyd impacted this work, and we saw these communities just really rise to action in support of their neighbors. So as centering as these community wellness hubs, we saw nearly 18 million meals provided to both youth and adults. We saw 228 new food access points developed. So again, things like food banks, farmers markets, community gardens. We learned that 31,000 households were provided with information about SNAP enrollment. So understanding that the park and recreation professionals were not the ones who could actually do SNAP and WIC enrollment, but rather provide information about these services. And about 330 community partnerships either began or were strengthened. And again, this was just in 15 communities. So it's so exciting to think of the power that these models hold and the impact they can have across those 7 dimensions for communities all over the country. So that's really high level, but on a more specific level, this is a look at the work of the city of Cunin in California. They were funded through this first wave of community wellness hub grant programs. And in full transparency, we are in our 2nd round of funding for this specific body of work at the moment. But through this initial grant opportunity, the city of Cunin actually worked to establish themselves and kind of rebrand as the Cunin Wellness Hub. So the Cunin Wellness Hub is really impacting their community, which is made up of over 80% of people of color, with about 71% Latinx, and about 15% of their community faces food insecurity. So they worked to impact their community by providing a platform for other community organizations to share their resources and services, while at the same time vocalizing the needs of community members to these organizations, which really position them as a connector between residents and organizations. They brought in a community health worker who works to connect farmers market attendees with produce vendors that carry specific food items. So this is a strategy that works to support local farmers. It increases nutritious food access for residents, and it introduces new recipes for utilizing the produce in market newsletters. So the community health worker asked around, what do you want to see? What's not here? Are you unfamiliar with any of these foods? How can we make this kind of a symbiotic relationship? Excuse me. So to address the gaps identified in the needs assessments that was connected, staff then worked to create marketing materials and began to offer programs to increase resident access to information and community resources. So in asking around about produce and the farmers market, what came out was that community members were unaware of other food access points. So if there were meal programs offered or food banks in the community, a lot of the community members weren't familiar with this. So the community health worker worked to create a distribution calendar to reduce the number of residents who were unaware of the days and times of monthly food distribution. They began to offer nutrition education classes in both Spanish and English, and they provided information about CalFresh enrollment, which is their local SNAP program. They promoted it in multiple languages. They also worked with community partners to offer health screenings and healthcare services like flu shots and other vaccines at their physical hub, which was a great step in addressing transportation and access to healthcare across the board. They also carried out their work through a systems change approach. So again, they brought in this community health worker as a funded staff position. They developed 13 cross-sector partnerships to support their work, and they modified their community engagement and health equity policies based on what they were learning by directly engaging with community members. So although they are no longer grant funded by NRPA in this space, through the 2 years that they were working with us, they set themselves up to really be a sustainable model. And they have been able to carry on their work through those sustained partnerships and through the strategic alignment. Second quick example is in Bristol, Connecticut. So this was a grant project funded in the Bristol, Connecticut Department of Parks, Recreation, Youth, and Community Services. It was originally focused on increasing access to youth sports by planning for and installing a bike pump track for kids in the community. But as their project progressed and the pandemic really became a key part, the project started in 2019. As we moved into 2020, they realized that their role serving the community was just, again, organically expanding. So where they originally saw themselves as just, I say just in quotes, but program and sports providers, they were now hosting vaccine clinics. They were offering food distribution, offering childcare for essential workers. They were organizing duffel bags with arts and crafts, toys, games. So families who were quarantined could still support their kids' learning and physical activity. They also continued prioritizing connecting with the community on an ongoing basis through a program called Bristol Cares. So the photo on your screen is of a Bristol Cares meeting that was held last summer. It was held in a park, a safe open space. People just got together and connected. And Bristol Cares was actually created in 2008 in response to the economic recession. But through the pandemic and through those conversations, the city continued meeting and ramped up meetings to now meet once a month for about an hour to an hour and a half. They bring together about 75 social service providers in the community. So police and fire, housing, planning, health, parks and recreation, mental health, substance use, workforce development, shelters, nonprofits, so many more. They all come together. They are there to just have open conversation. There is a specific topic each month that they talk about, but this space just allows participants to share resources, events, build relationships in the community, strengthen those partnership opportunities, talk about fundraising, determine what's available and what's not available in the community, and just really react to community needs. So this is more of that kind of systems level look at a hub model as we were talking about. So not necessarily a physical place, they're meeting in a park, but it's more of just those concepts that lend themselves to idea sharing and working together to meet the needs of the community. So speaking of resources, Tiff, I will pass it back to you.
Wow, I felt like time flew by. I think we have so much information that we want to share with y'all. There's just not enough time in the day. But if you grab that link that I dropped into the chat box a little earlier, it's the same one that's highlighted on your slide. That will take you directly to the Community Wellness Hub Toolkit. You'll read and hear a lot of things that you've heard today, but you'll see it in much greater detail, along with some key examples that you can use in your day-to-day work as you start to think about building a community wellness hub model, whether it's a physical space or whether it's a space where people can come together and share concepts and ideas, as Maureen has alluded to. Next slide, please. Okay, so we've talked about the Community Wellness Hub toolkit for quite a while now. And this toolkit, it contains evidence and practice-based strategies, resources, and case study examples similar to the ones that Maureen has shared with us today that give professionals, park and recreation professionals, and their cross-sector partners ideas and guidance to advance park and recreation as community wellness hubs. This toolkit also provides a process guide to creating a community wellness hub that aligns with the 7 dimensions of well-being. And the toolkit is based on an evaluation of 15 local park and recreation agencies that planned, developed, and created wellness hubs between 2020 and 2022. Next slide, please. As we mentioned at the beginning, through the middle body of the presentation and now, we do center equity at NRPA. We developed a framework for action and elevating health equity through Parks and Recreation Framework for Action. I'll probably refer to it as the Health Equity Framework for the rest of this conversation. But this framework is designed to help park and recreation professionals intentionally advance health equity by applying a racial equity lens when designing, implementing, and evaluating programs and services, and when developing an infrastructure, a maintenance, and operations plan. So rooting this framework in guiding principles provide a foundation on which park and recreation professionals and their cross-sector partners can create more equitable spaces, programs, and services to advance community health and well-being. The guiding principles of this framework are centering health equity, because when health equity is centered in strategies, initiatives, and policies, the full power of parks and recreations, and essentially your community wellness hubs, can be realized. Park and recreation are a pathway to advance health equity. When park and recreation professionals leverage their skills, assets, and expertise to create just and equitable access to programs, services, and activities, they in turn promote better health outcomes. Reimagine inclusion. In park settings, the concept of inclusion must go beyond ability and access and should include a focus on who, how, and where people are included. If you recall, we've spoke a couple times today about centering the lived experiences of your community members and using those lived experiences as leverage to build your community hub to meet the needs of an increasingly diverse population in all of our communities. A focus on learning. Sessions like this today, so committing to the work, requires a constant examination of self and systems, connection with individuals who are not like you, and a willingness to share failures and successes. As a researcher, as a scientist, I'm a big fan of finding disconfirming evidence that supports a good cause. Respecting the environment. Park and recreation professionals and the open green spaces they manage are catalysts for creating, maintaining, and activating spaces that are not only resilient and regenerative, but also celebrate diversity. And that's what we have in our communities. Whether we see it day to day or not, we need to celebrate the diversity that lives in our communities and center those voices in order to ensure that the gaps in health equity are closed. Next slide, please. We've also recently developed a health impact evaluation framework for measuring the process and outcomes of health and wellness programs, like setting up a community wellness hub. This framework for evaluation will help local park and recreation agencies and their partners better measure the impact of their health and wellness programs and initiatives, like setting up the community wellness hub, by connecting agencies to a multitude of existing evaluation tools, data resources, data analysis, and data collection tools, as well as other resources to support this work. This framework helps agencies better evaluate the benefit of their health interventions and communicate this benefit more effectively to local elected officials, members in the public, and philanthropic supporters. I'll drop a link to all of these resources in just a minute. Next slide, please. And how are we tying this all together? I can't believe what time it is already. I said we definitely don't have enough time to go through all this today in super detail, but I'm so glad we were able to give you some high-level views of what the Community Wellness Hub model is and how you can start to think about this model in your community. So as we tie it all together, we have to remember that park and recreation professionals are integral cogs in the public health system. Community wellness hubs address the root causes of health and social inequities. So peeling that onion back layer by layer to get to the root cause of why we see the disparities that we see. Park and recreation and their partners as community wellness hubs have the power to close the gap in the health disparities. And community wellness hubs are united by their shared goals of advancing health equity. In short, park and recreation professionals are uniquely positioned to create, in partnership with key collaborators, like some of you in this room who are not necessarily park and recreation professionals, but are key collaborators from cross-disciplinary areas, as well as community members. The people-centered community wellness hubs needed to address public health threats and harness the full potential of community to ensure that all people can thrive. And in closing, that will take us to our Q&A section.
Thanks, Tiff. And I will stop screen sharing here in just a second so we can have an open conversation, but just wanted to pause here. Our email addresses are on the screen. Always happy to connect and brainstorm and share ideas and lift up the work that's being done in your communities. So if you would like to connect, we would like to connect as well. And we can share our email addresses in the chat as well. So I will stop sharing. We can all see each other. So
Hi,
happy.
Tiff and Maureen. Great presentation. Super informative. Like you said, you shared a lot, and there's probably even more that we could talk for another couple hours about this. I'm curious, just kind of as I look at, this is being recorded, so lots of people are going to watch this, even if they're not able to be here right now. But on this meeting, the majority of the people are not in parks and recreation programs. So I'm curious, how often do these community wellness hubs originate from within parks and recreation programs? And how often is it that other organizations approach parks and recreation departments to propose something like this?
Yeah, happy to start. And Tiff, then please do jump in. Robin, great question. I don't have a hard and fast number, but I would say it's, I know we used the term symbiotic earlier, but I would use that again. I think Tiff and I approach this from a little bit of a jaded lens, since our members are those park and recreation professionals. So that's where we hear our origin stories. But we know that this is happening in the reverse all over the country. And what we're really working to do in this conversation and in others is, Tiff, to your point on the last slide, is to lift up the role of park and recreation professionals. So in kind of an anecdotal way, what we hear a lot of times is that these community partnerships exist already. And then once Parks and Recreation come to the table, there's kind of that element of surprise of, oh, we didn't know you were doing this, or, oh, we thought you were just doing sports camps or summer camp, or we didn't know you were providing meals. We didn't know you were providing healthcare referral services. So really working to ensure that Parks and Rec are at the table for these conversations that are happening, but we are seeing more and more the partnerships approaching the park and rec sector, as well as encouraging Parks and Rec to approach other community partners as well. I think a great example that we've seen is the role or the relationship between Parks and Rec and library systems, both serving similar populations in similar ways, and now working together to really support each other and lift up the services of both.
Yeah, Maureen, I don't think I can say it any better than that, because my main point was going to be that a large role that we play at NRPA is elevating the profession of parks and recreation, so that folks in this room, for example, who we would see as cross-sector, cross-disciplinary, interdisciplinary partners of parks and recreation, also see that value in the park and recreation professional, whether the park and recreation professional is directing the entire agency or whether that park and recreation professional is maintaining the landscape. So really understanding the role that park and recreation play in public health, it's important, and we know it, but not everybody sees it that way. I think to Maureen's point just a second ago about summer camps, sports, and things like that. A lot of folks see Parks and Recreation as that. And one of the things that we want to do is bring folks like you all to the table here, just like we talked about bringing stakeholders to the table for the Community Wellness Hub model, to have this conversation to say, how do we connect with Park and Recreation professionals then to move this work forward? Robin, you and I started a conversation before the call even took off about community integrated health strategies. And essentially a community integrated health strategy is community clinical linkages, connecting folks to healthcare, but not necessarily in the healthcare setting. Parks and Recreation play a key role in that. We have a couple of projects going on now and recently closed that I'll be really excited to share those outcomes with the broader public. But really, essentially, those earlier projects before the Community Wellness Hub model was established set the groundwork for this model to say, this is what community integrated health strategies, this is what community integrated public health can look like. So we see all of you in this room, regardless of what sector you're in, as partners to the Park and Recreation professionals who are the community cornerstones for a lot of the communities out there.
Awesome, thanks.
This is Nicole, and I'm with Johnson County, Kansas, and we have had some great partnerships with our Johnson County Parks and Recreation District over the years. They've been involved in our community health assessment and all sorts of things, I would say even for decades, truthfully. And I know one of the challenges we have is our county has maybe 20 different, I'll call them parks departments. They aren't all called the same thing, but we're recreation departments, and some of them are more of a parks department. Others have, more the recreation side too. And so I know that that's one of the things we've talked about, is trying to find ways to be more inclusive with some of the departments that just don't have as much staff or capacity. If you've got, how that goes. If you've only got 3 people and you have 6 parks to take care of, you don't always have the wiggle room, to branch into the other stuff. But we've had probably our best luck short term. We've had great luck with a lot of things long term, but more ongoing is also working with our area agency on aging, kind of having a 3-way partnership with programming that way. And we've had some really terrific things happen, with the 50+ group regarding arthritis and things like that. And we're really excited about this whole physical activity plan, just trying to find ways to get some more sustained things. Shelly and I have worked on stuff for 30 years, probably, not to age ourselves, but, so it's just fun to see this kind of the CHIP model kind of spreading further and wider. I think it's the best way to really make sustainable improvements.
Absolutely. Thank you for that, for sharing that. And I think I might have, maybe it was before the call started. No, it was during the call. We definitely see a lot of work going on with our local area agencies on aging. So the local AAAs. I work a lot in our healthy aging body of work, and we are trying to work with park and recreation agencies to build partnerships to embark on these stakeholder mapping and asset planning activities so that they can connect more with those local areas on aging. And you're absolutely right. Our park and recreation professionals are extremely taxed when it comes to work and capacity. And being able to venture into another area might not be in the cards right away. For those of you who are not aware, so park and recreation agencies, most of which are part of local government municipalities, receive less than 1% of appropriations annually. So they are all typically very, very have a very, very robust work schedule, if you will. But you'll find opportunities if you keep at the communication, you keep at including them in your stakeholder mapping and your community asset mapping. There will be opportunities, and I would love for you all in this room to stay connected with Maureen and myself, because we could probably connect you with park and recreation professionals or agencies who are embarking on this work with stakeholders similar to yourself.
Yeah, and I'll echo that. Excuse me. And Nicole, something that we have seen too, in the understanding that often these departments are, mighty teams of 1 or 2. A lot of times there's room for shared use agreements, so sharing space. So if we have the park land, but you have the people, come use our space. We've seen that with farmers markets where farmers markets are hosted on park land, but not necessarily managed by the Parks Department. That's just kind of an easily pictured concept, but a lot of times, a lot of programs are done in park settings through these shared use agreements. We have seen like mobile wellness units come and use parking lots. So they will come to a park or a rec center and not necessarily step inside the doors, but use the parking lot as a space where they can share their strategies. So lots of room to use each other. Yeah, Amy.
Thank you. And thanks for sharing such great information and your time and talent and expertise. I am with Bike Walk KC, and we are bicycle pedestrian advocacy nonprofit. At the core of what we do is public policy and advocacy work. And I'm wondering what unique challenges there have been with integrating that within this type of hub structure where local government through the parks is so involved, because I know that can be tricky sometimes. So I wonder if you have any examples or anecdotes on that front.
Yeah, really great question. And that is something we face, that as arms of local government, it can be tricky to navigate. I think the biggest challenge we see is leadership buy-in. Agency leaders or city leaders speaking up on behalf of this work is something that we see as a challenge. A lot of times the argument is kind of stay in your lane, which to what we started this whole conversation with was we see it as one of NRP's roles of lifting up the work of this profession and saying there is not necessarily one lane that this field represents. So it's really changing the narrative, and that starts internally a lot of times. We do have an initiative called the Park Champions Initiative. It had been running for a few years, took a little bit of a pause, but is now back in action, where it's essentially, I hate to say course, but professional development opportunity for park and recreation professionals to go through kind of understanding what advocacy is and what it is not, and how to advocate on behalf of their programs and services, how to invite elected officials to see this work in action, to be a part of it, to understand the impacts it has on the community, creating those stakeholder groups that we've talked about to really support each other. Those are some opportunities that we see. A conversation we've been having a lot with our members lately is just kind of demystifying advocacy. I think a lot of times people think it's going to your local capital or going to Washington, D.C. and having these formal meetings, and it's really just storytelling in a lot of places. It's not lobbying, it's not that official capacity. It's just telling the story and sharing that broadly and looking for support in those ways. So we're just kind of working to break down the stigma and support our agencies and our members through that.
Again, I don't have much more to add on, but I did want to share that, a lot of the resources that we develop, including this community wellness hub model, yes, it is aimed at and geared towards our park and recreation professionals, but we do see these as tools that show utility across community-based organizations who are working to improve population health and advance population health through strategies that center those community members. So while you may not be a park and recreation professional, by virtue of being in this room, you are a partner of park and recreation professionals, but you can also start to implement this work. This work is public facing on our website. We have all of our resources public facing. So where you see park and recreation professional, maybe you could put Bike Walk KC. I was actually thinking, being in DC, WABA, the Washington Area Bicyclists Association, very similar to Bike Walk KC. So that's what I was thinking about there.
I don't want to hog the time, but I do have a little bit of a follow-up because, for us, collaborative work is so, and those partners are just so important in furthering the work that we do. We just can't do it all by ourselves. But the advocacy of policy can make some partners feel uncomfortable, like we just discussed. And I'll just add to, and maybe this is just more food for thought, we also, Bike Walk KC has also done a lot of work in the social and racial justice space around the decriminalization of mobility. And we have done some focus groups with high school students here in Kansas City. We created a how-to guide for advocates who want to address the over-policing of certain communities when it comes to walking and biking. And you look at the statistics out there, and there are just disproportionate citations against people of color, LGBTQ plus communities, when it has to do with biking, jaywalking, that kind of thing. So I just wanted to throw that out there too, because I think when we talk about public spaces and parks and marginalized communities, those spaces have not always felt safe or welcoming. And law enforcement, just the idea of enforcement around mobility and who is sort of welcome or not welcome in those spaces is really something that I think is important for all of our partners to address. So.
Sure, Amy, you bring up a really great point. Park and recreation agencies, parks, recreation centers in general, they've been, as community cornerstones, they've been the center of a lot of events over 50 or 60 years. So they've been the cornerstone in the center of events for the first civil rights movement. They've been the cornerstone of those areas, but they're also embedded within the systems that continue to oppress others, that, they continue to, and I'm going to backtrack the word I just used, others, which is a horrible word for me to use there, but they are embedded in a system that continues to oppress certain populations. And so you bring up a really good point there, Amy. And what we can probably do as well is, stay in touch with us. We can help connect you with professionals in your area that, maybe we built relationships over time with, or we can connect with our other colleagues at NRPA. Maureen, thank you so much for sharing that. That is a beautifully done story map about equity in parks from a historical perspective. So please download that. But stay in touch with us so we can connect you to folks who are doing the same work and are like-minded in your area.
I've got another question if we've got time. I don't know, Katie, are we on track with everything, or?
Yes, we are
Okay.
on track.
Cool. Well, I was just wondering that I know there was some funding tied to the initial round of the 15 communities that did the community wellness hubs. Do you have any updates on if additional funding will be available, or just give us some idea of the funding landscape for some of these things?
Absolutely. So to fully back up, we've been working with the Walmart Foundation for about the past 12 years or so in different capacities. They've been really supportive of our shifting vision from kind of a single tracking grant making strategy to this broader community hub vision. So I mentioned in 2019, we were funded for a 2-year cycle to pilot this work. In early 2022, this year, we were funded for an additional 2 years to continue this work with a focus on sustainability. So creating systems level change in a way that is not dependent on grant funding. So our focus on these next 2 years is to work with 15 more communities, 10 new communities and 5 returning communities to really evaluate this work, see where we can best support it, and collect those best practice guidelines for these kind of non-grant fund dependent models. So how can we support the field broadly with their own systems? All that to say, the department in which Tiff and I sit, the Programs and Partnerships Department, we are continually applying for, receiving, and distributing grant funding in many areas across the field. So that's just one area that we fund. But we do work in a number of funded capacities, and we are within the next year or so looking to roll out a strategy that is more comprehensive. So it's less kind of one-off grant funds, but more building funding streams for the field that can be used in a variety of ways to support these different ideas, and be a little bit more responsive rather than reactive. So we are looking to build that, but all that to say, we are on just kind of an ongoing fundraising stream process. We have a really dedicated fundraising team, and we are always pulling in and redistributing funds. So that's a really vague way of saying we don't always know what's in the pipeline, but always happy to connect and chat and look for areas that we can work together.
I'm going to ask a mostly unrelated question, but Tiff brought it up at the very beginning in the chat and said you were going to be in Kansas City for the Kansas Recreation and Park Association state meeting. Are you presenting the
Yes,
same
I am.
information?
No, I'll be presenting on transgender inclusion in youth sports.
Okay, so at this point, you have not yet been asked to share this type of information in that setting. Is that right?
I have not been, no.
Okay, well, you guys suggested connecting us to local people. I happen to know the executive director there, and I think connecting people within the Kansas City Metro, and I realize you're talking on the Kansas side of the Metro, but bringing up this idea of community hubs is a great one to consider. And Nicole's already brought up how this ties into the work of health departments. We, of course, sit within a large regional health system. How could we, and we're looking at this from a system standpoint, how could we support that by connecting to others to this really new idea or concept related to I'm going to call it community engagement, because it has so many different benefits. And well, I'll stop right there and just say, great. And we look forward to meeting you in person, Tiff.
Thanks. I'm much shorter in person.
So am I.
I taught online for a while. When I finally met my students at graduation, they were like, oh, you're a lot shorter. But thanks. And, if an opportunity presents itself, please just let Maureen and myself know, and we will see who is who's got the availability and all that. And we'll share as much information as we can.
If what are the dates for when you're in Kansas? Some of us live on the Kansas side. So,
so it is the first week of February. I don't have the exact date. I'll be in Illinois the week before. Illinois in January, I hear, is balmy. Is that correct? How about Kansas? Is that area balmy in February? What?
Depends on your definition of balmy.
Yeah, so it's the first week of February. I'll be happy to share that information. Katie, I can send that information to you if you want to share that out. Okay.
Yes.
Yeah, so you have a standing invitation. Sorry, you have a standing invitation to visit Bike Walk KC.
Well, are there any other questions? If not, we're going to take a short physical activity break. Feel free to turn your cameras off if you would like. So I'm reading the chat. Okay, yeah, so I'm going to go ahead and share my screen again. I just want to say that was an incredible presentation. Thank you so much, Tiff and Maureen. I'm really excited, Tiff, for you to come in February. Veronica and I were chatting, and we're gonna come see you.
Thank you so much for having us. It was great to connect and meet all of you. And we love talking about this. So thank you for the opportunity.
Yeah, absolutely. And I know I emailed earlier, but feel free to stay on. We're going to take a short break and then come back, and we're going to have some group questions and just a in general discussion. Okay.
What time do we come back?
That's a good, so this video is for 5 minutes. I had it planned for 10 minutes, so 5 for physical activity and 5 just for general relief, and we have the time. So I'd say come back in about 7 minutes and we'll go ahead and start.
Okay, thanks.
Absolutely.
We're so happy to be a part of the Junior League of Kansas City, Missouri's 4th annual C3KC event. Children's Mercy and the Junior League have been partners and collaborators since 1950, starting when the Junior League members sewed diapers and surgical dressings for what would later become Children's Mercy. Since then, the League has raised money to fund the Cardiac Care Center and the Volunteer Coordinator and Parent Consultant positions, plus donated thousands of volunteer hours across many departments. What a wonderful community collaboration it has been, and we look forward to many more years working together. Hello everyone, my name is Bryce from the Center for Children's Healthy Lifestyles and Nutrition at Children's Mercy, Kansas City, where we work to promote children's healthy lifestyles and physical activity in the Kansas City region. Today we're going to do some exercises and some stretches for you guys. Most of these can be done while you're sitting or while you're standing, so let's get right into it. The first one we're going to do, we're going to lock our fingers and we're going to stretch all the way up to the ceiling. Try to touch the stars. Get on your tiptoes a little bit, and then we're gonna bring our arms down, right behind our neck. Bring our elbows in, and let's rock back and forth. Right, left, right, left. Good job. All right, back up to the starting position, and now let's get some head circles in. You might hear some cracks, that's okay. Good, and now let's get our whole body involved and let's shake things out a little bit. Get ready for some of these main stretches. Awesome. Let's bring our arms up and we're gonna do some core twists. We wanna get a little bit of a wider stance. We're gonna go left, right. Nice rock solid.
Hey, baby.
Perfect. All right, and all this can be done in a seated position as well.
Well, I'm just
It would be
in
this
this
type of
session, but I
variation.
saw you come in
And
and
we're
go.
gonna move on to the next drill. So we're gonna do
doing.
some knee pulls. We'll start with our right. You wanna grab right below the knee, pull up towards our chest, hold it for about 5 seconds. It's okay if you lose your balance, find something next to you, find a table or a chair. You can hold your balance just like that. If you're seated, you can do this variation. Back to our right leg. Good job. All right, and then we're gonna transition to some toe touches. Touch our right toe. Try to hold that for about 5 seconds. If you can't touch your toe, that's totally fine. Just touch somewhere in your shin. See how far you can get down. 3, 2, 1. Awesome. If we're standing, it's gonna look like this. See how far you can get down that shin. Try to touch your toes. Nice and controlled. We can focus on our breathing in through our nose, out through our mouth. All right, we'll do a quick hamstring stretch now. Our right leg, we're gonna reach down, grab that foot, pull up towards our butt. Good, hold for about 5 seconds. Awesome, left side. 2, 1, good job. If you're in the seated position, it looks about like this. Get a good stretch in. If you're not able to grab your foot, that's okay. The variation would just be leaning back and trying to reach down with your hand as far as you can. Good, all right, on to the next one. We're gonna get a glute stretch in now. When we're sitting all day at home, this is a good stretch to make sure that things are activated, our big muscles in our body are activated while we're sitting down. So we're gonna bring our right leg up, sit our ankle on our leg. We can lean forward for a better stretch, hold it, and then we can lift up on that leg just slightly. Good, we'll go to the other leg. If you're standing up, it looks something like this. Good. Lift it up a little. Okay, and our last one. Let's connect our fingers again. Let's reach to the stars. And let's slowly flow down into a forward fold. Grab those elbows. You can sway to the left, and the right, left, right. Sitting down, looks like this. Left, right, and good. There we go, guys. Thanks for joining me. These are all exercises you can do at home. And as we're sitting at home, if you're working from home or in a seated position throughout the day, these are fantastic ways to get moving in an easily accessible way. Thanks.
I just wanted to say that Melinda Shaheen just hopped off. Melinda works for UMB Bank. She's one of the co-leads for the mass media sector. And she actually was the person who recommended Tiff and Maureen to present to this group. She came across the community wellness hub model somewhere, and she thought it would be a great fit. So even though she just had to hop off for something else, I wanted to acknowledge her great work and help in helping set up this presentation.
Okay, so it looks like we have most people back. So our next item on the agenda is just hopping into a group discussion on the Parks and Rec sector. And I think we were going to do breakout groups. Are we still doing breakout groups? Or are we just thinking like one group
Yeah, I think
together?
we're gonna just do one general. I think if we had like the number we had started with, I might have done broke
Sure.
everybody out, but yeah,
Yeah.
I think staying in this general room is fine.
Yeah, it seems like we trickled down a little bit, so I think we can manage the 6 or so people that are left. So some questions to consider for our group discussion. They're on the slideshow, so if you want to just take a look, and then I can read through a couple of them as well, and we can just kind of open it up and pick one or two to answer and just kind of generate some discussion here. So first one, what is your organization currently doing to ensure that children are physically active? 2, what are the strategic interest goals of your organization that align with the strategies of the Parks and Recreation sector? Is there a project or program that aligns with the strategies of the Parks and Recreation sector that has potential for expansion or potential for high impact? What other resources would you like to see from the Kansas City Physical Activity Plan that could help agencies or community members? Could any of the programs you are currently running benefit from resources the Kansas City Physical Activity Plan has to offer? So those are some of the questions. Do any of those stick out to anybody? Robin, I see you got your hand up.
Yeah.
So, that's probably the best way to do it. If you have something to add, if you could just put your hand up, and then we can get to the comments as the hands go up. I think that's probably the easiest way to have discussion. Okay, sorry, go ahead.
Yeah, no, I just wanted to add one thing and as context, and then ask a question. The one point for context would be Katie did a nice job working with Jen and Allison on these questions with the idea of we are now moving to the implementation phase of the Kansas City Physical Activity Plan, and we are fortunate to have funding tied to those implementation plans. So we haven't formally announced it yet because we're still working on the process, but there's somewhere around $10,000 that's going to be available to each sector to implement projects. And so we're really starting the process to identify those implementation projects, and we'll talk more about that process in the coming months. But think about, as you're going through these questions, have that in the back of your mind in terms of what programs might want to be initiated, or whether if there's existing programs that might need some additional resources that we can provide. Obviously, we don't want to recreate the wheels if things are already moving. The question that I had further that I would propose to add to this group is just, what are your general thoughts on the community wellness hubs that we saw in the presentation? I know I came away very impressed with what they're doing and the frameworks and resources that they've created to support those. And I've got lots of course, my mind immediately goes to lots of cool things we can do, but I'm interested to hear what other people think too.
Well, if you don't, I don't have my hand up, but I'll talk since I'm off of mute. I thought it was a great presentation. I was just kind of, what I can say is being in the Parks and Rec world and being on like the Kansas City, Missouri side, we are in constant communication with partners, organizations, community members. And to be honest, it's pretty overwhelming, in my personal opinion, on how to partner and like who to partner with and like what makes sense for partnerships. Like, it just seems like we're being pulled in a 1,000 different directions. And so to see that there has already been work and research and education, like seeing that there's resources there that we can kind of follow some already tried best practices in the space and kind of figure out like what works for our particular area, and seeing that there's like a roadmap to creating a wellness hub. I think that for me was something that I was like, okay, good. Somebody has kind of already done this work, because I don't know where to start with it. And I don't know how to get going. Because we've just kind of done things here and there, but we don't have anything that would really, incorporate all of those. I think it was like 7 factors that you kind of want to incorporate into it, and like just know what that cycle looks like. It's just kind of like relieving to see that has already been done. So that was my thought on it.
Well, I of course loved it because I'm a public health geek, and that's how we roll on a lot of stuff. So, it was just exciting to see the sustainability part, that's kind of an emphasis, because a lot of this stuff doesn't necessarily it takes more resource to get started than to keep things going. If you have these great partnerships that are working for everyone. And, what I keep thinking about with this sort of stuff is, just to circle back to some of my comments earlier, I do think there are maybe 15 or more parks or recreation entities just in our county, and not that you want to start like a coordinating council or something, but maybe you do. I don't know. You know what I mean? Like to kind of, because it's impossible to think, like for our department, we would love to be involved in all of it, but it's impossible to think we could be involved with 15 separate entities, at the same time trying to do this. So, I always think trying to find ways to streamline it so it works for everybody, if that makes sense. Because even a lot of our parks might be owned by the county, but they're in a city. Or like you think about our trail system, a lot of our trails go through multiple cities. So even coordinating safe routes to parks or things like that. So I'm always trying to think of ways to streamline, to create efficiencies, but I don't have a starting point for that. But that's one of the things that's been rolling around in my mind.
Yeah, that council is, or I can't remember what you called it, the meeting of all the different rec agencies. So it is interesting to me, and I was just curious. So is there currently any meetings like that? I guess not in Johnson County, but within the region, or?
Well, that's one thing I don't know, and maybe that's something we could try to find out. I know that the only thing I know of for sure, and this is just my ignorance, it doesn't mean it doesn't exist. It just means I don't know. I know in Johnson County, they have a group, like a trails group that meets. I think that's why that was in my mind, because, a lot of these trails, like I said, could go through multiple cities. So I know they have kind of a trails group that meets, and there could be other things too. I know some of them probably work together for corporate challenge, and I don't know, I'm just kind of throwing things out there, but that might be something for us to investigate, looking for, like if we're trying to identify a project, it'd be nice to have something that was far reaching, if it could create some kind of an efficiency somehow to diffuse the information further.
Yeah, I just wanted to add, I think a lot of those councils or commissions focus on like specific program areas. maybe not specific regions. I think the one that I do know of, and it's a specific region, but also just a specific program area, is the Platte County Sports Commission. They, Parkville, Platte City, Platte County Parks, and Casey Parks coordinate with local partners in the sports world just to kind of pool all of our resources up in that Northland area of Missouri. And I believe that was something that was founded sometime in maybe the recent 5 to 10 years. And I think, all it really takes is reaching out and seeing who is willing to pool those resources together. I don't know if that's an easy feat, because that can be a big ask, is asking someone to spend additional time on an additional council or commission or, something along those lines. So, but I think it can be done, especially if there is a need. And it seemed like in that specific county, there is a need, because there's a lot of unincorporated area up in Platte County that just needs some resources. And so that's how that kind of came together.
I know she is not here today, but I wonder if Allison Smith with Johnson County might be a good person to ask, because she seems to do tons of collaborating. Not that other people here don't, but she seems to be one who's got her finger in a lot of things. So when she's available again, I could just maybe shoot her a quick email and just to see what other ideas we could, notions we might be able to come up with. Even if we could break the metro down into, I'm just going to say sub-segments a little bit, rather trying to do individual, departments at a time.
Sure. Amy?
Yeah, I'm kind of talking as I think out loud. I think just there should be some discussion, when we look at the equity lens and working with parks. It was just earlier this year with some of the stories coming out about parks on the east side not being as well maintained and kept as those on the west side. I think before maybe we jump into what programs and services to offer, and I just may not be aware of any kind of community engagement feedback, but for the communities that are near parks, especially those in marginalized communities, I think having a conversation with those communities, and that's often where there's, social determinants of health and life X zip codes, where folks are just facing a lot of challenges, is that what do they wish the park and rec services were doing for them? Because I think you're going to get different answers in Johnson County than you are on the east side of Kansas City. And so I think starting with audiences and populations and proximity, even where some of the parks are in proximity to neighborhoods, would be something. I don't know where I don't know what it just feels like we need to start there before we jump in. And it looks like, oh, Bill, I thought you're yawning. I thought you were gonna say something.
Amy, I think that's spot on. We actually have a new new deputy directors at Kansas City Parks and Rec, and one of the first things that they identified is that our master plan is out of date, and we need to update that master plan. And we're kind of just in the beginning process of that, but one of the big pieces of it is a community engagement survey throughout the whole city, trying to figure out, and literally one of the questions is, how far are you from a park? How often do you go to parks? What do you want to see? What are your needs when it comes to parks and recreation? So we are realizing that is something that we need to reevaluate. Blake?
Yes, hello. Just a couple things. First, I think the person from Mark had left, but Mark might be a good place to reach out to try to get everyone together if that's something we want to pursue. But I also agree with like identifying certain areas in parks. I think we're at a time where like right now in Wyandotte County, we're doing our community health assessment, which addresses our or informs our community health improvement plan. And so identifying things that way, we're also working on some projects to help improve like perceptions of safety and like make improvements to make people, because people don't use parks sometimes because they don't even feel safe walking around their neighborhoods. And we've recently just engaged with some neighborhoods that have done some walk audits and identified some infrastructure issues that need to be fixed, maybe more on the government side, but trying to create that line of communication. But anyway, I think for the community hubs, I think, yeah, if we could find a way to prioritize a few parks, and yeah, I don't know exactly what that would look like, or if we could just pull together some of our resources to put together kind of like a community hub, like kit that has like a tent and some basic supplies to set up in a park that we can kind of pass around, kind of like a community hub in a box or something. I don't know. Those are just kind of my general thoughts, but I agree with trying to maybe prioritize a few specific parks kind of throughout the region of everyone that's here. But yeah.
Well, I do know we have some of that zip code data, like, that's available, that information is available. So that's the good thing. I know we have certain counties that are, or counties, excuse me, zip codes that are designated, that, most counties I'm sure have regions or maybe whole counties that are, we've got 10-year disparities between different zip codes in our county. And so I know that there's lots of opportunity for that kind of work too. So, if we need it for regions that are not part of our group, I know between myself and our EPIs, I'm sure we could help find somebody to find it for us, when the time comes, if Children's doesn't already have it.
One additional piece of data we have that is, and Shelley helped me out here, maybe 10 years old, maybe a little more, is there were park audits done on every single Casey Mo park. I think it was just Casey Mo Park. And so we know, and Shelley, correct me, that was 2010-ish, somewhere around there. Or if someone else knows, what I'm talking about with Andy. Yeah.
I do, yes. I'm going to say 2010-ish. Jen, do you think that's about right?
Honestly, I have no idea. I'm sorry.
Okay.
Yeah.
I know that was before your time.
I know.
But
You're like 10 years before me almost. Yeah, so sorry.
yeah, something like that, Robin.
Yeah. So, that is something we've kind of talked about, is aggregating data like we've been talking about related to whatever it is, a health outcome or the built environment. I think there's a need for that. And we're kind of doing a couple different things to kind of address that, but that could maybe fall into sector related, kind of background work too. So.
Something else that I just kind of have to throw out there is I know that we've tried a couple different programs at our health department to try to provide some additional services that address like social determinants of health and things in community locations. And it really has been difficult getting people to attend those and getting the word out in the community that those are happening. And it is a lot of work building that trust with the community, especially if you are going into communities that are non-white, or like we have a lot of refugees. And so there's just like a lot of things to consider. And sometimes that capacity building, or just building a relationship of knowing where resources are in the community. If there is a park, if there's a community center, a lot of people aren't even aware of like those locations. So just something I wanted to throw out. That that has been like the biggest challenge, is just getting the community kind of there. And I understand it's because we haven't necessarily done our part of getting the word out and communicating effectively with those residents.
Shelley and then Amy.
Well, so this was mentioned earlier, and what Blake was saying made me think about it just now, but we've started in the healthcare sector of the Kansas City Physical Activity Plan. We have implementation groups. One of them is called Just Walk, and it's walking with a healthcare professional. And so we set it up in a park in Wyandotte County. It's at Pearson Park. We started this past spring, second Saturday of the month from 9 to 10. And so far, we've had 2 walks that really had community participants. Only 2 of all of those that we've hosted so far. Now, there are lots of things that are probably contributing to that, but one of them really is probably just getting the word out to the people who live in the neighborhoods or nearby, when, canvassing really isn't an option for us. But I bring that up because it seems to me that the idea of a community wellness hub connects with our work and across sectors. So Just Walk is kind of already connected across sectors because we've been involved with Parks and Rec. We were working directly with Wyandotte County Parks and Rec until the person who was participating with us, I don't think they work there anymore. So we sort of lost that contact. But anyway, all that to say, this is a potential cross-sector opportunity to start small in terms of thinking of a community wellness hub. The way the program is actually set up is they encourage you to do other sorts of things at the walk, whether it's screenings, sharing information. So I think it was the video that they were sharing that had examples of all the different things they were doing at their wellness hubs. But anyway, no, I'm rambling a little bit. I just want to throw that out there as a potential cross-sector, something that's already started and potentially build on.
Thank you. Amy?
Yeah, I think representation is extremely important. I'm just looking at, our faces in these little squares. I think we need to be prepared for being criticized for not having enough representation on these committees, and the way we structure whatever our goals and our engagement activities. It does take a long time. I think Blake said it takes a long time to earn trust. And Bike Walk KC, as a white-led organization, we're extremely aware of that. And we try as much as possible when we're going into communities of color when we offer compensation to serve on committees like this. We offer, I really think there needs to be some conversation around who's being represented, because that is going to affect how well the communities engage with what we're trying to propose. Yeah, I think that's really important.
Yeah, I think that's an excellent point. We have a youth program over the summer, and to get the kids to participate, we basically have to pay them or they're not coming. So, and I think there's other groups that do the same thing. I know with like the Move More, Get More, we talked about like, how do we get kids to stay in that program and wear their trackers and stuff like that. And it was incentives for them and the family to participate. So Nicole, you had your hand up, but then it may have come down. Did you want to add anything?
I just was thinking about both Shelley and Amy's comments. I know one of the things we've done is we finally found funding for our community health worker program. And so we feel like that's really helped us a lot addressing some of those issues. You know, they're just wonderful staff we've gotten there a little more, you know, we've been very fortunate to find people that are probably, it's always hard to say this delicately, but like they're Spanish speaking, they are not white, you know, and they go out and they're just doing a terrific job engaging in the community. And I think it's really helped us with some of that. You know, we've really seen an uptick in certain subpopulations as far as accessing services. They're very engaging. They do such a terrific job working with the community. It's really helped us with some of these issues that we're talking about here. And I kind of wonder if, at least with my department, if they might be a good resource for figuring out, like if we wanted to try to talk to some of these subgroups in the community, like if they wouldn't be the ticket to helping get that information and engagement, you know, at least through our agency. I mean, I think it would be a great opportunity to kind of gather that information. I know with COVID especially, we had a lot of, that was just such an interesting thing with all populations, but you know, we had a lot of really good luck with linking people with resources and things they needed, much more so once we brought the community health workers on, I think, because they spoke different languages. They it just has been great. So, you know, we might consider that if other agencies have community health workers too, trying to pull some of those types of people into our group.
Amy, do you still have your hand up from last time, or did you want to add something? Okay. No, I think those are all really great points. The community health workers, we've had a lot of luck partnering with our health department. They've been a huge resource. And I also think the point about building trust in the community comes from actually having a group of people that represent the community leading the change. It's a lot easier to gain that trust when people in the community feel like they're represented in the actual decision-making processes.
Yeah, I was just going to add that, you know, I'm so happy that people are bringing up these issues because I've noticed it comes up a lot in a lot of different meetings that we have in a lot of different sectors, you know, and so the challenge is how do you get that feedback? And, you know, there are two examples just mentioned there, you know, with the health department in KC-Mo and then in Johnson County, a little bit different twist on that. We're using the community health workers, and I think there's so many good options. And so maybe it's coming back to what I think we kind of started the conversation about is maybe starting smaller and identifying a couple areas and work on coming up with a way of a model, a framework for getting input from those specific areas, knowing that in another area it's probably going to be different, but there may still be some common themes or common strategies that are employed. And once you maybe figure it out in 4 different parts of the metro, then it can be disseminated out to other groups or other parts of the region as well. So just a thought I had.
Yeah, I think sorry, I didn't raise my hand. I think focusing on a community and really going deep, it builds that trust, and it also creates word of mouth so that it's like, okay, this program's legit. Like these folks take the time. They're not just a one and done and come in and set up and then leave and say we served 80 African American people, or folks are done. Folks are done with that. So I think that deeper engagement, I think, is a smart way of approaching it. It just provides us with more information, right? I mean, just in terms of data and qualitative feedback and all of that, far more than rotating something around to 20 different communities. So, and I just want to throw out too, if we can build in interpreters. I know, Robin, I think you all have access to that, but that's something that we've started. Bike Walk KC has started putting in grant proposals that we may not use the money because we often don't know where in the community we're going to be, but we want to make sure that we have resources for language interpreters so that our programs are more accessible.
Well, I think this has been a great conversation, and some of the things we addressed, we should really consider when we think about our implementation groups. Right now, we have 2 minutes left, and I'm going to go ahead and just wrap up so we don't run over or anything. So speaking of implementation groups, we don't really have time to discuss them, but these are implementation groups, and kind of think about what we just talked about and how they might fit into some of our groups that we do have. Just a reminder that the Parks meeting meets every fourth Wednesday, at least as of now. Oh, shucks. I just wanted to bring this up to everyone that we have a few other events, sector events, and I'm going to throw a link in the chat that'll direct you. Nope, that's not it, my bad. I will get that to everyone. I have a link that directs to our Kansas City Physical Activity website with more information. Oh, thank you, Robin. But yes, we have sports coming up, mass media, schools, and then we have the Kansas City Physical Activity Summit. Do not forget to register. It should be a great event. Here's also another way you can register if you want to scan the QR code. I'll take just a moment for that.
Will the parks, I don't know when the fourth Wednesday falls in September. Is that like the day before the summit? And if it is, will you guys kind of skip that meeting and instead just say, go to the summit instead? Probably.
Yeah, I need to.
Or yeah, go ahead, Jen.
I would say maybe we skip that meeting because it is the day before the summit, and just try to encourage everyone to go to the summit on the 29th and then pick back up in October.
It's also the sector special event for the school sector. The 28th is. So for anyone who might be interested in that, I'd encourage you to attend. It'll be a great conversation as well.
Yeah.
And I'll just give a quick plug for the summit itself. So Thursday, September 29th, 9 a.m. to noon, virtual event. We've got the director or the chairman of the National Physical Activity Plan will be our keynote, but he's only going to talk for about 30 minutes only. It's going to be a great 30-minute presentation. The remainder of the time, we will focus on cross-sector breakout rooms where we can really talk about all the things that we've been discussing in this meeting and what the healthcare group discussed in their meeting yesterday and what the sports sector people are talking about in a week or so. And all of that gears up for implementation projects and planning in the fall. So I think it's going to be a really valuable and really meaningful summit. We've got, I just checked today, we're at about just under 70 registrants already. So we're a month out and we're at just about 70. So I think we're going to have a great turnout and it's going to be great discussion. We've got paid facilitators that are going to be guiding our breakout rooms. So it's going to be a really, really special event, I think.
Thank you, Robin. You did that perfectly.
I've done it a few times.
Yes. On that note, that comes to the end of this meeting. If you would take a moment and just go ahead and evaluate how you think this meeting went. You can scan the QR code, or I'm dropping a link right now in the chat. I will also email it after this meeting. But yeah, thank you everyone for joining us. Yeah, I will leave you to it, and I hope you enjoy the rest of your day.
Have a great week.
Yeah, thank you.
Bye, guys.
See you guys.
Okay, yeah, I think we're good. Thank you so much, Jen, for
Yes, Katie, I know that you and probably Veronica put a lot of this together, so thank you for doing all that. It was incredibly helpful.
Yeah, absolutely. I'm really excited about the questions at the end. Like, we didn't cover those, but that conversation was amazing. Like,
I think in a way we didn't get, so I personally like to talk like, okay, this is how we're going to solve this. This is the plan. But I think I have to like leave some space for people who need to talk about like broader things. But I think we really touched on three a lot. Like, what are the programs? Like, what can we expand on? What has high impact? Like, we were kind of circling around that one a lot, just talking about like who, like basically like who do we get involved that would have the highest impact, I would say. Like when we're talking about certain areas of town that have the biggest gaps to close, I think.
yes.
But we didn't really come out with anything super concrete, which, like I said, like for me, I'm like, okay, here's the problem. What's the solution? Let's solve it right now. We'll solve everything before the end of this meeting. Obviously,
we'll figure it all out. We'll have
unrealistic.
all the
Yeah,
answers.
exactly.
Yeah.
We have solved all the world's problems from the Parks and Rec sector.
Yes.
You're welcome. No, but I thought it was a great meeting. Thank you, ladies, so much. And have a good afternoon. Absolutely. I'll talk to you guys soon.
Talk to you later. Bye.
Bye.